Hi, I'm Dr. Sally Primus. I'm a board certified ophthalmologist with Hometown Ophthalmology and the Dry Eye Center of Evansville. This video is a part of a series where I go through many of the common dry eye treatments and I talk about how they work, how to use them. I'll even try some of them out right in front of you. I'll talk about whether or not you can get them on your own or if you need a prescription, whether insurance might cover it or not. And I'm happy to answer any questions. And if you want to learn more, you can check out our website at either hometownophthalmology.com or dryeyevansville.com. In this video, I want to talk about how to clean those eyelids. Now, most people don't need extensive eyelid cleaning, but a lot of people who have dry, itchy eyes, the reason their eyes are dry and itchy is because their eyelids are not functioning very well. They have overgrowth of bacteria, the oil glands are getting clogged, or they have something called blepharitis, which is inflammation of the edges of the eyelid where the eyelashes come out. And those are all things that are treated over the counter for the most part. We do have some prescriptions we can do, but most of this is hygiene. It's kind of like brushing your teeth. You got to clean those eyelids. So I want to talk about some of the products that you can do for that. I want to first talk about wipes, and I'm going to show you a bunch of different options here. And I'm going to start from kind of low cost to high cost. The basic eyelid wipe is going to be your OcuSoft Original that comes in a blue box. And this is going to be definitely cheaper than the other options that I show you. And I'm going to show you how to do an eyelid cleansing, but this one has to be rinsed off afterwards. The rest don't, and so that makes it something like it's a two-step process, and some people forget to rinse it off and then their eyes are a little irritated. So I just warn people, if they're going to go cheaper, that's fine, but make sure that they rinse it off afterwards. The next version by the same brand is the light blue box. This is a little better quality of a wash, and it comes in a wipe as well, but it doesn't have to be washed off. I've had people say it's a little abrasive, but overall does a pretty good job. The same brand actually makes this one, and it's the Oust Demodex. For people who have a severe mite infection of their eyelids, we can actually clean with this. I don't recommend that any individual just goes and tries this, because this is going to be a lot more abrasive. This should be recommended by an ophthalmologist. The same brand also makes a specific one for allergies. It just kind of helps calm down some of that itching as well, but it works under the same basic idea. It cleans the eyelids. And then my favorite, but the most expensive one, is going to be the Optase wipe. These are going to probably run you double the cost of these, but again, they don't require any rinsing, and they're very gentle. So I'm actually going to show you how to clean the eyelids, and I'm going to show you one eye with this one and one eye with this one, and kind of just give you some feedback to say how it feels. So let's try them out. This one is the Optase. This is the gentler one. I've used this one many times because this is what I keep in my house. Comes in a little wipe like this. It has tea tree oil in it, which is anti-inflammatory, antimicrobial, and also kind of kills mites that like to grow in our eyelashes. You can use one wipe for both eyes. I like to wrap it around a finger. I pull the lower eyelid down. I'm not touching the eyeball at any point in time. And I just do little circles on the edges of my eyelid, back and forth, and then counterclockwise, clockwise. And then I close the eye. I do the same thing right where the eyelashes come in. I'm not scrubbing too aggressively because I do have makeup on, but I use this actually to remove my makeup at night. After I've done the edges of the eyelid, I'm going to do circles around and work myself all the way around, and I actually use the same wipe to take all the makeup off my face at night. Then I flip it inside out and do the same on that side. Right now, I have no burning. It smells quite good, actually, and my eye is comfortable. I do not have to rinse after doing the Optase. Now I'm going to do the OcuSoft, the original, the one that you're supposed to wipe. This wipe is a little bit smaller, but that really doesn't matter. It's kind of soapy. You can kind of like see little bubbles with it. So think soap, you got to rinse it off. Same thing. So I'm going to do lower eyelid. I'm not getting it in my eye. I'm just and I can even use a mirror. It feels a little soapy. A little got in my eye. It's not really burning. And then same thing. I'm just going to clean along here. And then I would do the same thing. I'd go around and around. I know that after I make this video, I'm going to need to rinse this off. I am definitely more aware of this eye than I am this one. I feel soapy and goopy, but it doesn't burn. It doesn't hurt. I used to tell people that they should do just baby shampoo. And you can do the same thing with baby shampoo if cost is a big thing. But if that baby shampoo gets in the eye, we have started to realize that baby shampoo will actually break up your tears and break up the oils in your tears, and might not be the best for dry eye. But if you can't afford the wipes, I would definitely recommend that over doing nothing at all. So if you're not really a wipe person, women tend to like wipes. Men often don't like the wipes. That's not part of their routine, and they prefer more of the foaming cleansers. So we've got some of those too. So we have they're tea tree oil based. They are safe if a little bit gets in the eye, and they come in pumps, and you can just keep it in your shower. And you basically a pump or two. You can even do a washcloth or on your finger, and again, just scrub the edges of the eyelids. You can buy these on Amazon. You can buy them here. These are going to be a lot harder to find in a store versus you can probably buy these at Walmart. So, but these are handy, and again, you don't have to have the wipe. Given that you're not opening up a new wipe every day, this probably is slightly more cost effective too. For people who have really, really thick debris in their eyelashes, and just when like the first time we see them, like, okay, you're going to need a lot of work on these eyelashes, we often will do a treatment. We have something called blepharitis. This is a very, very nice piece of equipment that will polish your eyelids. We have a much stronger foam that we will use in the office, and we will do a deep cleaning of those eyelashes to kind of jumpstart the process. Kind of like when you go to the dentist and they do a deep cleaning and get your teeth feeling nice and clean, and then you go home and brush your teeth to maintain the work that they did. And every once in a while you might need to touch up, but that's something that we do offer in office. None of these things in the video have any hope of being covered by insurance, and so they are all out of pocket. And so I welcome any questions about costs. I wish insurance did cover them, but dry eye is just kind of low on the radar on most health insurances. So don't hesitate to ask any questions, and I hope this video helps.